just got in our department. This is our department where we kind of go every morning to figure out what part of the hospital we're used in. Us as respiratory, you'll find us everywhere, including the NICU. We've got people that fly and do transports there, people that go to deliveries and C-sections. And then obviously we have a lot of us in the ICU where the ventilators are, of on Progressive where they've opened a new tower. There's a lot of pretty sick people there on what's called Airvo, which is a high flow oxygen that we set up and try to maintain and run and help people out. And this is where we keep our BiPAPs and our vents and everything that we come to get to do our job too. So you can see there's those ever popular ventilators that everybody talks about. We do have a good amount, which is always a good sign. And let's see where I'm at and what today's got in store for me. Gonna go get report now. All right, I'm getting ready to start our day in MICU, so I'm gonna go ahead and get my hair covered for the day. This is quite the job some days. Getting my PPEs on to go into this COVID room. The patient was having some increased difficulty breathing this morning, so we had to place them on a ventilator. We're gonna go in and check the blood, so I've got my gown, my mask, and I'll get my goggles and some gloves and be good to go. Okay, so now here we have the blood from one of the patients that has recently just been placed on the ventilator. So we're going to run it on my ABG machine so that we can see the results and see how well they're doing now that we've placed them on the breathing machine this morning. We'll see what happens. Okay, we just got the results from that blood that we ran, and we're going to go make some changes on the ventilator. That way the patient's blood gas levels even out, and keep continuing to watch him for the day. So I was able to give the patient an inhaler, and they were doing pretty good. So I'm moving out of ER, and I'm going to head over to oncology to help a different patient. So here we are in our department where all of our equipment's kept. We were able to get one of our COVID patients off the ventilator, which is great news. Now I have to, we wiped it off once in the room, and we're going to go ahead and wipe it off again, and then we'll take it in the back and we'll get it all checked off in case another patient needs it. So since I was over in oncology that's kind of close to our NICU, I'm not currently going in there right now because I've been out in the general population with the patients today, and just to be extra safe, our NICU therapists for the day that they are in there are not coming out to work with any other patients, and we are not really going in after we've been working with any other patients. But I did just want to swing by and see their faces and make sure they were all doing okay today, and make sure they didn't need anything from the department or anything like that, because it's quite a ways away. Hey, there's John!
Hi, I'm just here checking off our transports that we use for the picking up the babies. We have the ground transport isolate and the flight isolate, and we just check them every day.
Make sure they're working
properly.
Good deal. Hope that we don't have to go flying for any right now, right?
Me too.
But if you do, he's ready to go.
That's right.
Clean and ready. So getting ready to head up to our 6th medical floor. Actually, I'm here to check on the therapists that have this floor. This has been a pretty busy floor. We've got 6 progressive and 6 medical here, where we have a lot of the COVID patients and a lot of our work is there. We have people on BiPAPs and high flows of oxygen that we're just helping out and checking on throughout the day. So I'm gonna go see how it's going for them. Here's Donna. I just came up to check on her, and she actually just has taken a patient to our medical ICU from Progressive that needed to go on down to ICU. They get there okay?
Yes, they did.
All right, let's go see what else we can do. So we just took the breathing tube out on one of our patients, and they're doing great on regular oxygen. So that makes me super happy, because the difference is, instead of just maybe the family seeing him via some kind of internet video or whatnot, he's gonna actually be able to talk to them. Just makes me super happy. So I was just up in medical ICU trying to get a little bit of education on some new equipment. Unfortunately, we had a patient come in that needed to be placed on a ventilator. So I did that quick to help out a fellow coworker. As I was doing that, my pager went off about 4 times that they needed me in the ER. So now I'm heading back down to ER. One of the things I have to do when a trauma is going to come in is you have to be prepared for them to be on a ventilator. So I'm just going to get my net right in here before everybody comes in and get it all ready and set to go. All right, so here we are in ER. We're getting ready for a medical team activate. So we got our ventilators set up and we're gonna make sure the patient has an airway when they come in. Just finished up with that medical team activate. Unfortunately, it was a full arrest and the patient did not make it. I try to just take a minute and stop and think about their family and hope that they can find some peace in knowing that we did everything that we could, but ultimately, unfortunately, they just didn't make it. Kind of an unfortunate part of the day. I've worked in healthcare now for 22 years. I've worked at Parkview for 15 years. These are definitely the most trying times that I've ever been through in my career. We are obviously using more respiratory therapists per shift than I could ever have imagined that we'd need, because we are the ones that are running the ventilators and assisting with putting people on ventilators when they need breathing tubes, and going to any kind of emergency situation that has to do with breathing in the hospital, which obviously there's a lot of them right now, so it's definitely a trying time. But what keeps me coming back is I kind of view my team, my coworkers, as like family. Sometimes I spend more time with them than I do with my family, and hoping that at the end of the day I have made someone's life easier by helping them maybe to breathe, or just being there with them in their last parts of their life. And it's definitely a good feeling when you know that you helped to save a life. There's nothing like that. I definitely leave here some days and feel great about my day, and then some days I leave here and don't feel so great, and lately those days are a little more than feeling good. But at the end of the day, I still know that I helped somebody, I hope. And that's all I can do right now.